Over the years, Natalie Portman has captivated audiences worldwide with her timeless beauty and versatile acting skills. But has the Oscar-winning A-lister ever had plastic surgery? Estimated costs of potential procedures are provided at the end of the video, so make sure to stick around. In 1999, at the age of 18, you can see that Natalie has high brows. Natalie appears to have a relatively slim nose and minimal tip bulbosity. She has a short, well-defined philtrum with upper tooth show when she parts her lips. And her lips appear to be quite full, with the lower lip being fuller than her upper lip. In the year 2000, at the age of 19, when we look at Natalie's hairline, we can see that there's no widow's peak. She appears to be between an M-shaped type of hairline and a rounded hairline. She does appear to have some hair in the frontotemporal region, though it is thinner there compared to other parts of her hairline. In the year 2001, at the age of 20, Natalie has full tooth show when she smiles. In 2002, at the age of 21, Natalie has a rounded upper forehead. Now, this type of appearance can sometimes give the illusion of a higher hairline, but it's not necessarily so. The horizontal thirds can still be balanced and proportional, but when you look at the hairline, it can appear to be higher because of how curved some people's foreheads are. And when people come to me for hairline lowering surgery and we're measuring those thirds, what we sometimes find is we really don't have to come down on the actual hairline height because it's already proportional to the middle third and the lower third. Instead, sometimes doing some rounding along the frontotemporal corners is all someone needs to make the overall forehead appear smaller. But in Natalie's case, that roundedness does not detract from her look at all. Instead, it gives a beautiful feature that adds to the uniqueness of her face. You can also see that Natalie has some infrabrow fullness, and that of course is another sign of youth. That's that natural fat pad that lives just below the eyebrows themselves. And in looking at Natalie's nose, what we can notice is this central cleft, and that's right between the medial crura of her lower lateral cartilages. And that to me is a sign that she has not had a rhinoplasty, because when rhinoplasties are performed, usually that cleft is effaced with a suture, so it starts to look like that cleft never existed. But being that that cleft is still present in Natalie's case, I think that this is her natural original nose. In 2003, at the age of 22, we see here that Natalie's lateral canthus sits higher than her medial canthus. And the aging process tends to flatten the appearance of the eye, where the lateral portion starts to slowly droop down as these tissues out here laterally get weaker with time. And while canthoplasty surgery attempts to recreate that appearance, it can be very difficult to mimic the natural appearance of the eye that you see here in Natalie's case. In 2004, at the age of 23, what I wanted to point out here is that while Natalie's nasal tip has slight bulbosity, it really fits very well with the rest of her face, specifically her prominent cheeks and her chin. If her nose was even smaller and her nasal tip made to be very small with a rhinoplasty surgery, my thoughts are that it would then be mismatched with the rest of her face. It's important to take into consideration the entire face when planning specific procedures on the face, instead of seeing it as a standalone feature that, when tweaked, will not affect any other part of the face. I think that's the wrong approach to take. It's better to consider the big picture and how adjusting something might fit in with the rest of the face and not treating it in isolation completely. Another feature that I see here is that Natalie has an acute submental angle, and that's in part due to her strong mandible, also partly because of her hyoid positioning. When the hyoid bone is positioned higher and more posterior, it creates that more acute type of angle rather than an obtuse angle. And also, this angle has something to do with the degree of submental fullness. And that's influenced by the degree of fat that exists in that area, as well as the size of the submandibular glands and the bulk of the digastric muscles that are in that zone. In 2005, at the age of 24, Natalie here has a short haircut, and that allows us to see her natural part line, which exists closer to the left side of her hairline. And the part line is where the hair starts to change directions. Remember that hair at any part of our scalp and any other part of the body has a certain direction and angulation, and that needs to be mimicked closely when we do hair transplant surgery for things to look as natural as possible. Also, in the profile view, we can see that when Natalie smiles, her nasal tip does tilt slightly downwards. And again, to me, this is another sign that she has not had a rhinoplasty, because usually with a rhinoplasty surgery, when the tip is adjusted, it's sort of fixed into position. So as the tip is rotated up, it can be suture fixated there. And when you smile, the tip does not come down at all. Now, some people go into a rhinoplasty wanting that type of change, but it is very natural for the tip to droop a little bit when we smile. And you can see that in a very subtle way in Natalie's case. In 2006, at the age of 25, I see no change, and that's the same through 2011. In 2012, at the age of 31, I'm seeing the potential introduction of Botox or some other neurotoxin to the usual areas like the forehead, the glabella, and the crow's feet. To me, it's highly unlikely that at age 31, she would have absolutely no creases when she smiles in those areas without any neurotoxin on board. But her look is still very natural. She does not look completely frozen. I would say it's on the light side of Botox. In 2013, at the age of 32, I see no change. And in 2014, at the age of 33, I also see no change. In 2015, at the age of 34, when we compare Natalie's appearance at this stage to 10 years prior in 2005, we can observe some changes. She's had some slight cheek descent with very early signs of jowling. And the neurotoxin, I believe, is helping her skin appear very smooth. For someone to keep their skin looking very smooth and blemish-free, some of the approaches that people take is to use retinol, and that helps with increasing cell turnover and the overall regeneration of skin. It's also very important to protect from the sun, because we know that sun damage, especially the accumulation of it over many years, can really leave the skin looking much more aged. And to keep our skin looking as hydrated as possible, it's important to have a great facial cleanser, an HA serum, and a facial moisturizer. And by now, thousands of people have tried our Feel Confident products, and they really enjoy that luxurious feel of those products, and the fact that they're available at affordable prices is a huge plus for many people. And I really appreciate that our viewers and subscribers have given our products a chance and are now actually incorporating it into their daily routines. That means a lot to me and my team, so thank you so much, and we'll continue to make great products for you. In 2016, at the age of 35, I see no change, and that's the same through 2018. In 2019, at the age of 38, I think Natalie is a great example of what a natural face looks like for someone in their late 30s. There's been a trend towards younger and younger women getting facelifts, as young as in their 20s and 30s, and I have a recent video on this topic, so please make sure to check that out. And a large part of that is because I think people, as they start getting HA filler earlier and earlier in life, they're starting to see some of the changes that come about with using that over the course of years, and seeing the HA filler migrate and start to change different features of the face, and then chasing that with early facelifts has been a trend that I've observed. But I think Natalie's case shows us that there's something to be said for being as natural as possible for as long as possible, to then delay needing any type of surgical intervention until maybe much later in life. In 2020, at the age of 39, I see no change. And in 2021, at the age of 40, I also see no change. In 2022, at the age of 41, we're seeing some age-related changes, such as reduced infrabrow fullness. Also, there's a bit of crepey skin at the lower eyelid. And Natalie's philtrum appears to be less defined than it was in her earlier years. I'm also seeing the potential introduction of very light cheek filler. I think even if she had that done, it's been done very minimally and also tastefully. To my eye, at the medial cheek, there's a bit more volume there, and I'm seeing more of an effacement of that lower lid to cheek junction, and that can sometimes happen from cheek filler. Anytime someone's looking to improve the lower eyelid area and the tear trough region, it's usually recommended to start with cheek filler if you're looking for a non-surgical approach, rather than jumping into using filler directly into the tear trough, because that can be a tricky area to fill and you can get a puffiness that appears there, and it's very delicate skin. Usually as the cheek itself is filled, that starts to make the tear trough look a little less noticeable. But Natalie still looks like herself. It just looks like potentially the medial cheeks got a little bit more volume, and that still looks very natural. In 2023, at the age of 42, I see no change. And in 2024 and into early 2025, at the age of 43, Natalie does appear to have some signs of aging, but she still looks like a beautiful woman in her late 30s, early 40s. And she looks wonderful and she looks real. And I think this is a very achievable goal for many women and men. It's a great example of sometimes it's what you don't change that makes all the difference. And now in 2025, with so many different options for people for aesthetic enhancements, both surgical and non-surgical, it can be overwhelming for people. I think it's important for us as a society to take a step back and to think, maybe less is more. Maybe I should wait on that filler or the Botox or the surgery that I had in mind and see how my face or my hair does over some period of time before jumping into a procedure. I think that's something worth considering, especially in this day and age. And the total cost of these potential non-surgical procedures is about $80,000. Natalie Portman shows us the incredible impact of combining natural beauty with subtle enhancements along the way. If you found this breakdown interesting, please make sure to like, subscribe, and turn on that notification bell so that you don't miss another one of our videos. And as always, drop your thoughts or any other celebrities that you'd like me to analyze in the comments below. Thanks for watching.